Hi, welcome to another episode of the Smiles Ahead podcast. We have Sir Ryan Kelly here from, if you want to get a little introduction to your practice.
Yeah, absolutely. I work for Performance Rehab Associates, which is a multidisciplinary practice here in the Charlotte area. There's 3 different offices. I'm specifically out of one down in Pineville.
Okay. Yeah, very good. And we were talking a little bit offline. It sounds like you've been here, getting used to it. You've been here about a year.
Yeah. I'm used to the North Carolina life, so
North Carolina life.
Yeah, I like it so far.
Yeah, a little bit milder winters than coming from where you did school, right?
Yeah. I actually like the snow, so I wasn't sure how I would like the weather here, but this is kind of hard to beat, man.
Yeah.
This time of year is awesome.
It is. Sometimes that snow, but you can always fly out to the snow when you want it, right?
There
you go. Well, chiropractic, it's awesome to have you on. Obviously, being in the dental field and the jaws and trying to put all that together, it's super important to look at the rest of the body. So we love to talk to people like you, kind of bring this around. I always like to start with just kind of your story and how you got into being a chiropractor and how you found your way to Charlotte and how you found your way into your practice. And just a quick overview of your story a little bit.
I didn't always know that I wanted to be a chiropractor. I went to a chiropractor a couple times growing up, but honestly, it wasn't an integral part of my story or anything. I kind of wish it was.
Yeah.
I grew up playing sports. I went to undergrad studying exercise science. I went to a small school called Point Loma Nazarene University out in San Diego. I played some baseball there. Ended up getting hurt a lot, so kind of wish I had been more involved in the rehab world during that time.
Yeah.
But honestly, that brought me really close to this profession. I graduated in 2020, so it was the peak of COVID. I wasn't really sure what I wanted to do. I was actually getting ready to go back to school to get my master's in kinesiology.
Okay.
And then everything kind of shut down out in California. So I started shadowing a bunch of people. And I was back in Colorado at the time. And we made this garage gym, and I was doing probably stuff I shouldn't have been doing. And I threw out my back lifting. So I went to the chiropractor, and he's like, hey, you should really come shadow me. So I started shadowing him, and he started talking about the scope of practice and everything you can do with it. And I realized I could kind of blend strength and conditioning with chiropractic, more of the rehabilitation side of things. And I decided to go for it. So I moved to Iowa, went to Palmer College of Chiropractic. That was a big transition for moving from Colorado to California and then to Iowa. So,
Yeah.
But I spent 3.5 years there. I loved every bit of it. My last 2 rotations I did at the VA hospital in central Iowa. And then I went down to Nashville and did a sports rotation at a place called Active Spine and Sports Therapy with Dr. Jason Hall.
Oh, cool.
And then I came here, met my boss is Dr. Markle. His wife is Dr. Erin Markle. They basically started this with Dr. Cipriani. They have 3 locations now, and they were kind enough to bring me onto the team. So it's been such a great place for me to grow and develop in my first couple of years out. And,
Nice. So it sounds like kind of sports. And I'm thinking you're out maybe Colorado, Iowa, California, like the active life, the skiing and all that stuff. There, a lot of people come in with sports related, like or maybe they did something earlier in their life, or sounds like a lot of people. They're like, hey, I used to play football, or I used to do this and that. And I used to live really hard. Is that kind of a lot of the patients you see, or is it a big mix of people coming in with specific problems, or people coming in like, hey man, I don't know what's wrong, but just something feels off. Like, what is your typical patient? Or is it all over the map?
There's a little bit of everything.
Yeah.
We do treat more of like an athletic-based population just because that's honestly a lot of what we treat. But we also see a lot of unique cases. The physical therapists that I work with specialize in vestibular care. So there's a lot of people who have maybe not been turned away by the rest of the medical community. They've been like, hey, we don't really know what to do with this.
Right.
So we get a lot of those people as well. There's not a lot of, I guess when people think chiropractic, they think mostly like adjustments, all the stuff they see on Instagram and TikTok. There's not, I can probably count on like one hand how many people come in just to get adjusted at our practice.
Yeah.
So it's a lot of hands-on stuff, active care, rehabilitation type stuff. A lot of athletes, but also I kind of treat everyone like an athlete in their own respect and regard because everyone likes to do something.
Right. So without adjustments, just for somebody that is maybe hasn't been much experience with a chiropractor, and they're thinking about, okay, maybe I could use this. What does a typical visit look like if you're not, most people think of, like you're saying, like the big crack, and all of a sudden it feels amazing, 100% better, but that's not really how it can be. Right?
So it doesn't always go like that.
Yeah.
There's some there's a lot of, that's the cool thing about chiropractic. The scope of practice is ginormous, right? So you can do pretty much whatever you want it to be. Yeah. Right? Our practice runs off 30-minute treatment times for the chiropractors. The physical therapists run off 40-minute treatment times just because insurance structure is a little different.
Yeah.
But 30 minutes, and that can look like anything from any different people. Sometimes people require more hands-on stuff. We do different modalities like dry needling, shockwave therapy.
Okay.
Pin and stretch, manual release, fascial technique, anything like that. And then we specialize in different active care stuff. So dynamic neuromuscular stabilization, which is a fancy word for developmental kinesiology-based exercises. Mm-hmm. And then standard exercises like graded exposure to getting back from an injury like squatting, deadlifting, anything like that. Yeah. So it really kind of depends. But we run off that 30-minute model. And if people require more time, we have ways of doing that. So it kind of depends from person to person.
Yeah, I guess it's a good way to look at it. They're kind of customized to what that person needs. I know a lot in the dental world, whether it be general dentistry or orthodontics, we can do a lot in the office, but that person's not brushing their teeth, or they're not flossing, or they're not doing this. And in our case, orthodontics are not wearing their rubber bands to correct their bite at home. So the home care stuff gets super important. I know with chiropractic and physical therapy and that type of stuff, like, what's beyond a chair? How do you educate your patients on, like, hey, yeah, you come to see me, but what's required of them outside? Is there much stuff where you recommend, like, hey, do this you're not going to see me every single day, but if you're doing these little exercises every day, or you're doing these stretches, there's a big component of that.
It's huge, man. Yeah. That's kind of where the sustainable change comes from, right?
Yeah.
You can make an intervention, make the body feel a different way, but at the end of the day, we're humans, as you see with, if you didn't put braces on someone's teeth, right, they would just kind of go back to the way they were.
Right.
If I don't wear my retainer every night, my teeth are going to go back.
Exactly.
Same thing with your body. It falls into its natural patterns. So if you don't give someone maybe a good corrective exercise, or get them moving, maybe it's just simple as like, hey, you need to move more.
Yeah.
Then you're fighting an uphill battle for sure.
Yeah.
So that's a big component of it. But then again, you also have a lot of people who do too much.
Yeah.
Back into it. So
yeah, I guess especially with you working with maybe a lot of sports people, like they're used to going 1,000 miles an hour. You're more like, hey, pull back. Like, you can't do that as much as you can. Well, we honestly do have some people. It rarely happens, but if they're wearing an elastic one way, you're like, all right, now you got to wear them the other way because you actually wore them too much. So we get the same thing. But yeah, that's interesting to know because I feel like this day and age, people are looking for such the easy route. Like, I'll go to the chiropractor, snap my neck, and I should walk out of there feeling great. It's like, well, sometimes you can do an adjustment. I'm sure that feels good, but other times you're like, this is more of this type of issue or a muscular issue. And,
absolutely. Especially when you're looking at a lot of those people who have been in pain for a long time.
Yeah.
Right. It's not always. It's awesome to get like a miracle, like
right.
You're Jesus.
Yeah, exactly.
It doesn't always work like that.
Yeah.
Unfortunately. Yeah. Sometimes people don't get better, right? Like,
yeah.
And that's I feel like an important clinical thing to learn is, what is your patient?
Yeah.
Not everyone's going to be your patient.
Yeah. Exactly. So just for the people out there, like we're saying, to me, I'm a little bit naive to probably everything that you could possibly do. If you could tell, if there's one major thing to get across to people about what a chiropractor can do, or what the importance of spinal alignment and the nervous system, or just getting that out there to the public, what would be one big thing that maybe is a misconception, or people don't quite understand that this is why it's important?
Sure, yeah, absolutely. I would say that one of the things that I've realized that a lot of people don't necessarily know off the top of their heads isn't common sense is that I think chiropractors are very good portal of entry providers, meaning that a lot of people don't know that we are educated to view the body as a whole.
Yeah.
And then we can order the necessary testing and imaging if we need that off of that, basically. So if you come to the chiropractor, let's say you think you have a herniated disc, right? You could go to the emergency room, which I'm not negating. There's definitely people who should go there.
Yeah, right.
Get that taken care of. But if you came somewhere else, we could maybe take the steps to get an X-ray, an MRI, and determine, hey, is this a case that needs to go somewhere like that to maybe a neurosurgeon for a consult for an injection or surgery? Or is this something that we can treat conservatively? And a lot of the times, if it is something that you can treat conservatively and you take that other route first, it ends up saving you not only money, but time in the long run.
Yeah.
Because sometimes if you go So like a primary care physician for something like back pain,
Right.
it sends you down a rabbit hole that takes a while.
Right.
And sometimes doesn't lead you to the best spot.
Yeah.
And the other thing I would say is, especially in our practice, we treat a lot more than just the back.
Yeah.
So we treat a lot of knees, ankles, feet, shoulders, all the above. So to the point where sometimes I'm like, dang, I kind of want someone to come here and back.
Yeah, right. You're like, hey, wait a minute, I thought we were doing spots up here. Yeah.
But yeah, and then to your point about the nervous system and everything and just kind of the body in general is, I don't think it's good to ignore your body. Like we know our bodies better than anyone else, and anyone per se, not just you and I. But your body's probably trying to tell you something. Yep. So do something about it, right? It's never good to sit on pain. The longer that pain or discomfort sticks around, the harder it is to treat it and get it to go away.
Exactly. Yeah, no, that's a great perspective. My personal experience with it, when you're talking about the chiropractor looking at the whole body, which I had no idea this was going to happen, it was probably when I was back in residency. So I was back here, and my mom got me to go see one because dentists were this way, that way. We're all over the place, and we're probably uneven, and so went in, and after talking to him, we ended up on my acid reflux. Weirdly enough, I don't know why me and the chiropractor were talking about that, but like you said, he was bringing it all around. He actually gave me some more herbal, non-invasive medications. I was taking all the Prilosec and all the stuff to keep acid down. He's like, actually, it's probably that you don't have enough acid in your stomach. So he gave me some stuff, and I swear that's the only thing that's ever fixed my acid reflux to this day. So I was very impressed that the chiropractor looking at everything. That we went from talking to my back to my acid reflux. And I know that's probably an outside their case, but I always thought it was funny. I always tell people, I'm like, you know who fixed my acid reflux? It was a chiropractor. People are like, wait, why were you at the chiropractor for acid reflux? I was like, I wasn't necessarily there for that. We just started talking about it, and it got around to that, and he was able to fix it. So, just looking at, like we all try to do as a dentist and orthodontist, the mouth is like the portal of what you could consider a lot of diseases. Sure. A lot of stuff comes in this way, and we got to figure out how's that going to affect the heart, how's that going to affect everything else. So, looking at, we deal a lot with TMD, so TMJ joints and stuff like that. So, unlike, just like the knee and things of that nature, having a chiropractor looking at that. I don't know if you've dealt with any of the TMD stuff.
A lot more than I ever thought I would.
Yeah. Okay. Yeah. And probably you're more, we look at it as such a complicated joint because that's the only joint we really look at, but you're dealing knees, ankles, that, so they all kind of would come together.
Sure.
It's cool.
I took when I was going through school, I took a seminar pretty early on about TMJ.
Yeah.
And TMJD.
Yeah.
It kind of blew my mind.
Yeah.
When I first learned that there was actually an articular disc.
Yeah, right. Yeah.
Just like the spine, obviously it's different from an anatomical perspective.
Yeah.
That was crazy.
Yeah. You're like, all right, here we go. Same kind of joint, just different place. Now, last thing, I know we gotta get you out of here, get you back to work, but what's like a common misconception, fear of the chiropractor? So obviously in the dental world, we deal with fear all the time. People typically don't like to come see us. Sure. Trying to put, hey, this isn't going to happen to you, or you're not going to. There are some risks. Every procedure has a risk, but I think the fear sometimes is very exaggerated on the dental side. How about the chiropractor side? Do you ever see people be like, I knew I should have come in here earlier, but it just, kind of, what's the fear based on that, and what should people think about it?
Sure. I think it's fear, and I also think it's doubt. From a risk perspective, there's always a risk. Like you said, with any medical intervention, there's always a risk. I think a lot of people, like, the thing that scares them the most is the big neck adjustments. Yeah. Like, which I understand. Like, I don't really want someone doing that with my neck. Right. I think now it kind of depends on where you go. Yeah. I can tell you one thing: if you come to our practice and you don't want to get adjusted, they're not going to adjust you. Right. So there's other ways to treat you. So I'd say that's probably a big misconception. Just if you think, hey, this is off the table for me, like touching my neck is off the table for me, that doesn't mean that we can't offer you something that's going to get you better. Oh, okay. Yeah, that's huge. I didn't even know that. So for everybody out there, any type of issues, we've got a whole different ways. It's kind of like dental. We have, hey, absolutely say no to that. We recommend this, but if you can't go that direction, we can go this direction if you're more Sure.
I think everybody going in there and just think more, like you said, more doubt or education. If the person figures out like, okay, they're just doing that, and this is the case. I think they're in good shape. Well, Ryan, thanks so much for coming on, man. If you want to give a shout out to, again, your practice and where you're located, you're down closer to the Pineville.
Yeah, we're down in Pineville.
Okay.
Performance Rehab Associates. Reach out, whatever you need. And this place is awesome. So if you haven't been here, you should definitely come check them out, because this is a pretty sweet practice. So
nice.
Have a place like this.
There you go, man. Ryan, go enjoy your day. Thanks for coming on.
Thanks,
All right, buddy.
Thanks for listening to the Smiles Ahead podcast, powered by Burrow Welchel Culp Orthodontics. Be sure to leave a rating, hit that subscribe button, and if you have more questions, you can reach out to me directly at sam@bwcortho.com. That's sam@bwcortho.com. You can also visit our website, bwcortho.com, and we will be happy to answer any questions you might have.